I request our esteemed chief guest, Mrs. Gayatri Das, ma'am, to speak few words for all of us.
Good afternoon to all of you. Dignitaries on and off the dais, doctors, nurses, and everyone present here in this hall, press and electronic media. First, I thank the Some Ultimate Medicare management, and especially Dr. Padma Das, the CEO of Some Ultimate, for inviting me to be the chief guest of today's program to celebrate International Women's Day and International Nurses Day. Before beginning my address, I quote Sri Rabindranath Tagore. আমার মাথা নত করে দাও হে তোমার চরণ ধুলার তলে সকল অহংকার হে আমার ডুবাও চোখের জলে O Lord, let me bow my head in reverence on the dust of your feet, and whatever arrogance and pride I have, please wash it with my tears. The life of women is a selfless one. Unless we completely surrender our arrogance and pride to the Almighty, we cannot do anything. Today, we have gathered here to celebrate International Women's Day and International Nurses Day. In 1945, the Charter of United Nations became the first international agreement to affirm the principle of equality between men and women. The UN celebrated the first International Women's Day on 8th March 1975. The theme for this year is Invest in Women. Let us celebrate International Women's Day by extending our deepest gratitude to all the remarkable women in our life, be it your mother, wife, sister, friend, even a home help in your house. My husband, Dr. Das, says, mother is the creation of human life. From a microscopic cell to a complete human being in the womb in 10 months' time is a miraculous event shared by all of us. The greatness of women lies in the creation of human race, I unquote. He did this sketch on one of the International Women's Day. To make women empowered in every field, be it political, cultural, health sector, etc. 8th March is observed all over the world as International Women's Day. All of us must work together to make it a success. If you will all remember history, think of Jhansi Rani Lakshmibai and Rani Ahilyabai Holkar, how they fought bravely with the enemy to save their states. After the death of Rani Ahilyabai's husband, Khanderao Holkar, her father-in-law took charge of the kingdom and governed it. After his demise, Rani Ahilyabai governed the state smoothly. She shifted her capital to Maheshwar in Madhya Pradesh on the banks of river Narmada. The weavers of Maheshwar were sitting idle, not weaving the Maheshwari saris you people are wearing. She encouraged and started the weaving of Maheshwari saris there. The women weavers also joined it. I have gone to Maheshwar and seen the palace and the weaving. And of course, I have bought few saris also. In recent times, Dr. Kuntala Kumari Sabat was the first lady doctor of Odisha. Dr. Josna Dei was the first FRCOG of Odisha, and she started the Department of Obstetrics and Gynecology in SCB Medical College, Cuttack. And her sister, Beena Dei, also studied in England, and she was posted in Periphery. I have met both of them. How women are empowered. Think of Kasturba Gandhi. She was a beacon of light for Mahatma Gandhi. In Odisha, Ramadevi Chaudhuri, Malati Chaudhuri, Annapurna Maharana, Sarla Devi, they left everything behind and joined the freedom struggle. They responded to Gandhiji's call of independence. At those times, they were empowered. Now we are thinking of women empowerment, but already they were empowered so many years ago. I have the privilege of working with Malati Chaudhuri, Annapurna Maharana, and Ramadevi. After the death of after the death of Kasturba Gandhi in 1994 in Aga Khan Palace, people of India donated 1 crore and 38 lakhs of rupees to Gandhiji in Wardha. With that money, he started Kasturba Gandhi National Memorial Trust, having his head office now in Indore. For the upliftment and empowerment of women and girl child in rural areas of India. And we have centers all over India. In Odisha also, we run 11 village centers. And our head office is in Satyabhamapur, the birthplace of Madhusudan Das. Now I'll give you the example of Lijat Papad. Everyone, all of you are buying Lijat Papad. In the year 1959, on 15th of March, a group of ladies from Mumbai, namely Jasovanti Ben Jamuna Das Popat, Pratibha Ben Ramdas Thodani, and few other ladies of same thought process started Lijat Papad with the capital only 80 rupees. Now Lijat Papad is being sold in India and abroad. Now their empire is now of 1600 crores. This is called women empowerment. Now we'll come to Odisha. Here also women are being empowered. We have an organization, it's already been read in my biodata, created in 1990 by Srimati Rasmi Mohanty, who has done his MBA from HIMB. The name of the organization is Unnayan, which works for the tribal women of Mayurbhanj district. More than 100 women and men are standing on their own feet. They wanted to travel by air, so we took them from Bhubaneswar to Kolkata and back. They are making Baripada Mudhi. Baripada is very famous for Mudhi. And that Mudhi is only available in BPCA outlet in Chandrasekharpur and nowhere else. Because it's in high demand. Now we have a Mudhi cluster, and also we have given goat and country chicken, desi kukuda, to the tribal women to rear and then sell them. In Jagat Singhpur, it's already been mentioned, you know the golden grass, kaincho. In Thailo, there are a group of ladies working on golden grass. They are making different items. I couldn't find one in my house. I was in a hurry, otherwise I would have brought it. Golden grass, and the products are marketed. You can see it in Google and buy it also. It was also demonstrated in G20 in Delhi. We the women have determination, and also at the same time we are empowered. We can easily reach our goal. Our bright example is the Chief Executive Officer of some ultimate Medicare, Shweta Padma Das, my loving Shweta. I have my association with her long back, and I know her determination and how she fought. She's so determined and so strong. I'm very proud of you, Shweta. Always remember, if anyone is not coming with you to help or whatever, you don't need a group of people to work together. You may not. If you're alone also, think of Shweta. As I say this, it comes to my mind, Rabindranath Tagore has rightly written, Jadi tor dak shune কেউ না আসে তবে একলা চলো রে, একলা চলো, একলা চলো, একলা চলো রে. This is about women's empowerment. Then I will come to International Women's Day. The International Women's Day is being observed on 12th May. Already Sweta has said, I have nothing to say. Every year, the theme is chosen by ICN, a federation of more than 130 national nursing associations around the world. This year, the theme is, as she has said, our nurses are future, the economic power of care. Despite being the backbone of healthcare, nurses often face financial constraints and societal undervaluation. Nurses are the backbone of patient care. Without them, it's not possible to take care of the patients. The doctors examine them, do whatever procedure they want to or require, prescribes the medicine. That's okay. But the nurses take care of the patients 24/7. I have seen in many hospitals in India, which I have visited with my husband, Dr. J.P. Das, the sincerity, dedication of the nurses are seen to be believed. Here also. Here also, in your hospital and other hospital, I have seen them working tirelessly, sometimes skipping their lunch and dinner. One of my close relatives was admitted in some ultimate for corona. His oxygen saturation came down to 85. He was shifted to your hospital and was under the care of Dr. Banambar Rai. With both doctor's care and nursing care, he survived. And the patient was also a doctor. He was trained in CMC and PGI Chandigarh. My younger sister's husband. Thanks a lot to some ultimate Medicare. My husband, Dr. J.P. Das, was admitted in Apollo Hospital 5 times in critical condition. I have seen how the sisters were taking care of him. Sweta has gone and seen it also. And he was also there. I think he was first admitted first time. Sweta was there. Even the smiling face and the sweet words of consolation give a lot of solace to the patient. It has a soothing and psychological effect on the patient concerned. They are the real caregivers. The nurses have dedicated their life to the patient care. The society owes so much to them. Gopabandhu Das, Utkalamani Gopabandhu Das, has rightly written, Manava jibana nuhoi kebala barsha masa dina danda, कर्मे जिए नर कर्म एकातार जीवनर मानदंड. The scale of one's life is to dedicate oneself to the karma, the work assigned to him or her. He or she lives with that and dedicate this life to the work assigned to them. The nurses are the backbone of our healthcare system, the incredible work they do. I again congratulate and bless them and wish them all success. I again thank the Some Ultimate Medicare for inviting me to be the chief guest this afternoon. Thank you, all of you again.